Hello, my name is David Conlon, and I'm going to be talking about the relationship between COVID-19 and cardiovascular disease. So, the big picture question that I want to ask is how are SARS-CoV-2 virus and cardiovascular disease linked? We know that there is a relationship between them, um, and I also want to go further and look into the lockdown as a result of COVID. How does this maybe change the risks of cardiovascular disease, and then such, how would the virus interact with the new change in risk, and so on and so forth. So I want to start off by talking about the SARS-CoV-2 virus. The SARS-CoV-2 virus first emerged in Wuhan, China in 2019 and has since caused millions of deaths on 6 continents and even more hospitalizations and permanent damages. It's a respiratory virus, so it primarily affects the lungs, but it has been known to infect other parts of the body, such as the small intestine, liver, kidneys, and what we're going to be looking at, the heart. So, cardiovascular disease. It is the number one leading cause of death in America, and it has been for about 80 years. And this is kind of a broad category, but that can be broken down into strokes, coronary artery disease, heart attacks, and more than that. One of the things I want to note and make mention of is troponin C. This is a common biomarker that doctors use that can indicate heart damage. So essentially, if we notice troponin C in the blood serum, then it is likely an indication that there is damage to the heart. Moving on, the risk factors for cardiovascular disease. These will link into the more changes in lifestyle as a result of the lockdown, but some of the more common ones are smoking, unhealthy diets, and the big one being a lack of exercise. So if we can take a look over at the graph on the right, we can see that a low physical activity has a huge risk of cardiovascular disease. In fact, in kind of middle-aged and elderly patients, we see it in about 70% of the population that have low physical activity. We kind of see it similarly with obesity, that it is a very large risk factor. It's present in about 50% among all age groups. Unhealthy diets are also there, but maybe more so on the lower end. There's some other important ones, but we're going to be mainly focusing on diet, obesity, and low physical activity. So, before we can move on into the lockdown lifestyle, we want to look at cardiovascular disease as a comorbidity for COVID-19. So what this means is we have seen patients with prior cardiovascular disease have an increased risk of death from COVID-19. There's a few theories behind this, and maybe they all apply, but some of these go into talking about that because of a weaker heart, the body's not able to cope with the virus as much, so it may be an increased risk of death there, or that the heart may become more susceptible to an infection, and thus possibly a sudden heart stoppage or any other kind of death by that. So what we can see over on the graphs on the right are elevated biomarkers. So we can see troponin, albumin, and different other biomarkers, and generally how they're increasing in cardiovascular disease patients versus non-cardiovascular disease patients with COVID. And so the combination between cardiovascular disease and COVID has also been seen to increase as opposed to just someone with cardiovascular disease, indicating that the addition of the virus to a patient is causing more heart damage than there would be normally. So this could be an indication that there is an infection of the heart or some other similar mechanism. So now we've gone through all of the kind of background information. I want to talk about the lifestyle changes and how SARS-CoV-2 is affecting us as a population. So one of the first things, and one of the more obvious things, is we're not going outside as much. Well, it might not be as relevant in the summer, especially as winter comes around. There'll be less sunlight and then thus reduced vitamin D. This will not be as huge of an issue because a lot of people drink milk, which is fortified with vitamin D. But vitamin D has been known to protect against COVID-19, specifically the cytokine storms that it can do to infect other tissues and similar other mechanisms. So a reduced vitamin D may increase the susceptibility to an infection or make an infection worse. However, what I want to focus on mainly is physical activity. So obviously if we're not going out, we're not getting as much physical activity. Even if you just walk to the store, you might not be doing that anymore, thus decreasing your physical activity. And as we saw earlier, a decrease in physical activity is a huge risk factor for cardiovascular disease. So this could lead to an increased risk of cardiovascular disease, decreasing your health more, and maybe making getting the virus easier or at least worse if you do happen to get it. And people with obesity are at an even greater risk. As we saw, obesity was a risk factor in its own. However, this added among top less physical activity can really increase the risk of cardiovascular disease or at least set you on the track for heart damage down the line. The graph on the right also tells us some of the other things where if we go out and exercise, we get aids and antioxidants, anti-inflammatory, the immune system, which helps kind of combat mental illness. And while mental illness is a serious thing that is happening because of this lockdown, is outside the scope of this talk. Another thing to kind of take note is diets are becoming less healthy due to lockdown. There's been a lot of binge snacking and kind of eating out of boredom. And this kind of goes into obesity and an unhealthy diet and how these may all also be risk factors for cardiovascular disease. So, what should be done? Well, the first is to kind of control eating. This would mean reducing binge snacking, eating out of boredom, things like that, and also just kind of maintaining a healthy and balanced diet. Make sure you get a balance of vitamins and all that kind of stuff. The probably more important side is to making sure we're still staying physically active. Um, so this could be just going for a walk, safely, or perhaps doing something inside your house or wherever you are to get some kind of physical exercise. This would help reduce the risk of cardiovascular disease. This would help reduce the risk of death from SARS if you had cardiovascular disease. Um, and just kind of, it would annul the relationship between SARS-CoV-2 and cardiovascular disease that we've been talking about this whole um, lecture. So these are the sources I used, and I hope you all learned something, and thank you for listening.